Assalamualaikum, Miss.
Waalaikumsalam, Miss. Sit down, please.
Yes, Miss, thank you.
My name is Eva Irawanti, SRD in Selang Agung Hospital. Are you ready for today's meeting?
Yes, Miss, insya Allah I'm ready.
Okay. Don't be nervous. Just relax, please.
Yes, Miss.
Since there are so many interviews today, I'm going to hurry up a little, Miss.
Okay, yes, Miss.
Can you say full name and your address?
Yes, Miss, my name is Eva Damayanti. I'm from Jepara, Central Java.
Okay, I continue to the next question. Tell me about yourself.
I'm a graduate of Diplomatry Nursing in 2021 in Sultan Agung Islamic University with a GPA of 3.75. As a graduate, my motivation for working in this hospital is that for me, there is nothing more satisfying than helping people when they need it most. Then, my experience in clinical practice in a hospital can help make a person feel comfortable, relieve the pain they feel at then at the time, and only and I learned that overcoming their worries and making making sure that their voice or heard are just as important to them as receiving quality care.
You to be a nurse?
Being a nurse is a noble job. For me, there is nothing more satisfying than helping people when they need it most, and being able to help or care for someone to recover from illness, provide comfort, so that it can be motivated. Plus, two more work opportunities to become a nurse are needed both at domestic and foreign.
Okay, next. What specialty do you choose?
Since I'm currently a graduate of Diplomatry Nursing, if later I have the opportunity to continue my studies and choose a specialty, I want to choose a midwife nurse specialty.
Why did you decide to choose this specialty? Why did you choose your specialty of nursing?
I choose a specialist nurse midwife because I have previously worked with midwives as assistant midwife at a midwife clinic in the area where I live. Therefore, by choosing a specialist nurse midwife, I already have these skills, although not too many, but I'm sure I can add and develop my knowledge and skills in the field of specialist midwifery. Nurse study that I want easily because I already have experience before.
Next, do you want this job?
I choose this job because I believe it fits my abilities, such as the requirement list in the job opportunity poster that you post on Instagram, namely having a registration certificate or STR, female gender, having clinical experience and PDCLS training. Their requirements are in accordance with me, and I believe I can provide the best quality service in this field.
Hi, Miss.
Yes, Miss, I'm here.
Experience?
Experience. As a graduate, I have not that much work experience. The experience that I have is clinical practice experience at the Sultan Agong Islamic Hospital for 3 years in study diploma nursing, and I also have work experience in the midwife clinic for about half a year. Clinical practice experience includes the pediatric ward, VK or feral scammer, lead ward, and in the community. The skills I have are providing care to patients. For example, pain management, oxygen therapy, examination of vital signs, collaboration in drug administration, wound care in the ward pediatric, adult, VK or maternity, community, or elderly. Include assessment, intervention, implementation, and evaluation. Apart from that, I also have excellent communication skills, which can help me to interact effectively with patients, families, doctor, and other members of the healthcare team. My other skills include observe patient and report on well-being, keep a track record of patient medical histories and symptoms, perform diagnostic tests and analysis results, operate medication equipment, provide medication, provide medicines and treatment to patients, teach patients how to manage their illness or injury, and perform nursing care, assessment, diagnosis, intervention, implementation, evaluation. Then until now, I always remember the skills I have acquired and improved the skill. Then when I was an assistant midwife, the experience I gained were helping patients give birth, giving immunization to babies, antenatal care, fetal heart rate counters, preparing drug, and had been prescribed by the midwife giving birth control.
Do you have certificate, Miss?
Yes, I have Miss.
Oh, okay. Next, where did you get your training and what qualification and certification do you have?
The certificate I have is a nurse registration certificate that I got after passing a competency exam and a PTCLS training certificate while still studying at Sultan Agung Islamic University. To be precise, when the competency exam was over, and during study, I got clinical experience at Sultan Agung Islamic Hospital, and I have work experience with a midwife as assistant midwife in a midwife clinic in the area where I live.
Oh, okay, Miss. Uh, what type of situation do you find stressful on the nursing floor? How do you manage it?
Can you repeat, Miss, your question?
Oh, okay, Miss. What uh, type of situation do you find stressful on the nursing floor? How do you manage it?
Oh, okay. A situation that can stress me out are when I have a problem with one of my team members. For example, a difference of opinion that creates a conflict at work. Then makes me unable to be professional at work because of the conflict. To overcome this by communicating the conflict well with a person connected and then looking for solution according to the problem being debated so that there are no more difference of opinion.
Oh, okay, so good. And the next, if you work in this hospital, how much salary do you want?
Uh, I I don't think my current
Hi,
salary
Miss.
is relevant, but if you have to have that information, I will provide it after you share the pay levels and ranks for this job.
Okay, do you have any question for you?
Um, yes, Miss. I want to ask about what are the performance expectation for this position. Well, will that experience expectation change the longer I do the job?
Okay, Miss. The job expectation you want be explained during the orientation phase. If you are admitted to this hospital, there will be an orientation phase for you. That's the answer for your question, Miss.
Yes, Miss. Thanks for your answer.
Okay, arrive here for today's interview. For further information, we will inform you via email.
Okay, Miss. Thank you for your time, Miss.
Welcome.